Welcome back to the King's Podcast, the Wellness Dive with Lackie. I'm your host, Esther Lackie. Most of you have heard the word gallstones. What is it? When does it come about? Or how does it actually come about? And the gallbladder. Sometimes when you have gallstones or gallbladder disease, you hear that it just needs to be taken out, just yanked out of you. Does it play a role in the body? Well, to find out, today we are joined by Dr. Rakesh Rai. We had him before, where we spoke about pancreatitis,
Yes.
remember? Dr. Rakesh is a consultant hepato-pancrato-biliary surgeon. What a mouthful. Here at King's. Doctor, welcome and thank you for joining us today.
Thank you for inviting me here.
Yeah, so doctor, I'm just gonna jump right in. What are gallstones?
Gallstones, as the name is very obvious, when you have stones formation in the gallbladder, because that's not a normal phenomenon. So we are not supposed to have stones in the gallbladder. Whenever we have stones in the gallbladder, we call it gallbladder stone disease.
Doctor, the last time you were here, we discussed pancreatitis and gallstones sort of found their way into the discussion. What's the connection between these two?
Yeah, it's very important, as we discussed last time, that acute pancreatitis can be a life-threatening disease. And one of the most common cause of acute pancreatitis is stones in the gallbladder. Some small stones or the crystals or the sludge can slip out of the gallbladder, go into the bile duct, go into the terminal portion of the bile duct where the pancreatic duct opens up, and they can block the pancreatic duct, causing acute pancreatitis. So gallstones can be one of the most common cause of acute pancreatitis.
And so, as a result, for this to treat this, the gallbladder has to be taken out.
Yes. So any patient who has got acute pancreatitis and the cause found to be gallstone, his gallbladder needs to be removed to prevent further episode of pancreatitis.
So what role does this gallbladder play in our bodies if it has to be taken out to treat something else?
So there are two ways to think about it. The first thing is whenever we talk about taking away the gallbladder, at that time, most of the time, these gallbladder is not functioning gallbladder. They're diseased gallbladder. So anyway, they are in the body and not functioning. The second thing that you have to weigh the risk and the balance. So even if gallbladder has got some function, but in certain cases, the gallbladder disease can be very dangerous. In that case, we need to take away the gallbladder. Now, earlier we used to always talk about that the gallbladder doesn't have much function and, gallbladder can be removed and it may not have much consequence for our body. Things are changing. Although still we consider that gallbladder may not play a very important role. But if you see the literature in last few years, there is a evolving concept. Once you take away the gallbladder, the whole physiology and metabolism of bile changes, and that may lead to serious consequence like non-alcoholic fatty liver disease and NASH and other kind of metabolic syndrome. But this is a very current concept.
All right, so the gallbladder is not so much like the appendix.
No, definitely not. Definitely not.
All right, doctor, moving on. So gallstones, back to that. What is the main cause and can it be genetic?
So, there is no specific cause in most of the time in most of the patients of gallstone, but there are certain factors which we call as predisposing factors. So the people who have got those factors, they are more predisposed formation of gallstones. Like if somebody has got, he's on high calorie diet, he has developed obesity or overweight people, they have a tendency to form cholesterol stones. Now, the second scenario is there are certain conditions like, hemolytic anemias where your blood is basically getting destroyed very rapidly. Those are again the people who are predisposed to gallstone formation. There is some genetic link as well. But if you see the majority of the population who have got gallstone, you cannot pick up a specific cause for them why they have gallstones.
Do you have the statistics worldwide off your head?
Yeah, most of the people, as I said, 70-80% of population with the gallstones may not have any specific reason behind it.
And just to be clear, not all these people show the symptoms which you are going to discuss.
Yes, so yes, definitely. So you can have gallstones within you without causing any problem at all.
And you'll be fine.
Yeah, you'll be fine. Yeah.
Is the condition life-threatening? Can it be life-threatening?
So gallstone, as we discussed, can be completely asymptomatic. You may have gallstone, you don't know about it, and it may be lifelong like that. And the other spectrum of gallstones are they can be life-threatening. Like one of the example we discussed is acute pancreatitis.
Yeah.
Gallstone can cause acute pancreatitis, and it can be life-threatening. There is also a little correlation of gallstones with gallbladder cancer. That can also be a very severe disease. So yes, gallstones may not always be completely benign. It can lead to serious problems.
Like cancer. Who is at risk of this? Who can catch? Can children catch gallstones?
Gallstones, yes. Kids even 1 or 2 year old can develop gallstones, and you can develop gallstones even at later stage. But most common age group is around 40.
So last time when you were discussing about pancreatitis, you sort of let us know, described the pain that one can experience when they have an attack.
Yes, yes.
What about the pain you experience when you have gallstones? Can you
Yes,
describe it?
yes. So it's very important, to understand that, because when you have pain related to gallstone, there are a lot of similar pain which you can have, as you rightly said. You can have pain of pancreatitis, which may appear similar. You can have pain related to acid peptic disease, gastritis, a lot of things. So that's why what we call as typical gallstone pain, mainly this pain is episodic. So it comes, goes away. Okay, it doesn't last for days and days. So it's episodic pain. It's usually in the upper part of the abdomen, or slightly on the right side of the midline in the upper part of the abdomen. Okay, and this pain sometime can radiate to your back. So that is a very classic description of a pain which is episodic, suddenly starts in the upper part of the right upper quadrant, what you call on the right side, radiate to your back. And this pain can be mild, moderate, or severe in intensity, and it may be associated with nausea and vomiting as well. So this is a typical description of gallstone pain. But this is a typical description. There can be presentation which varies. Yes.
And so, doctor, when somebody experiences this pain, at what point should they come and see you? Or should they just take Panadols or anti-inflammatories?
As we discussed, there can be a lot of other reasons of pain in the upper abdomen. So if they have got mild pain which settles down on its own, probably they don't need to. But if you are having frequent pain, or if you are having moderate to severe pain, definitely you need to attend to a hospital or to your general physician to find out exactly what's the cause of pain.
And what's the worst that can happen if I don't come and see you?
So if it's related to gallstones, so we know that once the gallstone starts causing problem, they will cause frequent problem. So their problem, whether it's related to sort of pain, whether it's jaundice or pancreatitis, something or else will keep happening. So asymptomatic gallstones keep giving rise to problems. And it may lead to complications.
So can it be categorized like you categorized pancreatitis? Can gallstones be acute or chronic?
There are 3 or 4 different presentations of gallstone disease. One is, as we discussed, they may be completely silent, what we call as asymptomatic gallstone disease. The symptomatic gallstone disease can be either presenting as what we call as biliary colic, where you only get pain, episodic pain, and then it settles down without painkiller or with painkillers, but it's not associated with anything else. And then you can have acute cholecystitis, where the gallbladder gets inflamed. So it's not only pain, and the pain lasts slightly more, intensity may be more, patient may get fever and become unwell. Okay, so that's acute cholecystitis. And the other is chronic cholecystitis, where you have recurrent attack of acute inflammation, and finally gallbladder wall becomes thick, fibrosed. It's called chronic cholecystitis. And that's the presentation related to gallbladder. But gallstone can also slip out of the gallbladder, can go into the bile duct. You can have jaundice, it slips down, cause acute pancreatitis. So there can be different presentation related to gallstone.
All right, doctor. Okay, you've convinced me to now come and see you in your clinic. What are my options? What are the treatment options?
So if you have some symptomatic gallstone, it's very important that you get further evaluated and get treated. Why evaluation is important is to confirm whether these stones are the cause of your problem or not, because you may have asymptomatic gallstone. Second, whether it's only the gallstone causing problem to your gallbladder, or whether there is any stone which is lying in your bile duct as well, because that also needs to be addressed. But the treatment for symptomatic gallstone is most of the time it's the surgery. Gallbladder needs to be removed. Yeah.
The one who started this.
Yeah.
So just in a few seconds, what can happen? What happens when the gallbladder is removed? Are there any side effects to this?
So there are two things. One thing is the surgical complications, which happens with any surgery.
Yeah,
There are
of
certain
course.
complications.
Yeah.
And then there is what happens if the gallbladder is not there. So as I said, most of these gallbladder which are removed are non-functioning gallbladder. Anyway, they are not functioning in your body. But in certain people, there are certain changes which will happen. A lot of people, they develop kind of loose motion change in their bowel habit after surgery, but usually they subside with the time. But otherwise, there is no serious long-term consequence if you remove a diseased gallbladder. They lead a normal life.
All right.
Yeah.
So gallbladder removal.
Yes.
Is a standard
treatment for symptomatic gallstone disease. Yes.
All right, doctor, you've convinced me. One day, if I ever suffer from gallstones,
yes, you must get it removed. Yes.
All right, doctor, thank you.
Thank you.
Until next time, I look forward to seeing you again.
Thank you. Thank you. Thank you very much.
Ladies and gentlemen, Dr. Rakesh Rai. You had the man right abdominal pain. Up, actually. Upper. Yeah. You feel that? Come see him or call 800-7777. Until next time, see you.